Another bill that could affect public safety is being pushed by mental health workers for additional funding.
A public meeting at the Anoka Metro Regional Treatment Center this week gave a diverse group a platform to push for legislative support. CTN's Joe Nelson was at the meeting and has more on why the funding is needed.
Action is needed now, this session, in the next 3 weeks.
A panel pushed the importance of more state funding for mental health hospitals Tuesday at the Anoka Metro Regional Treatment Center. Governor Mark Dayton supports the effort and is asking lawmakers to approve more than $175 million, with $30 million going to Anoka in the current legislative session.
There has to be the resources to make it happen, both in technology, infrastructure, but most importantly in staff and the clinical level of expertise needed.
Staff at the facility saw an increase in volatile patients and sustained more injuries amid complaints of excessive restraints on patients and other mistreatment.
Our collective vision is that Anoka is not just doing mediocre care, but actually Anoka is innovating and creating the best practices around mental and behavioral health.
Problems at the treatment center led to a potential loss of federal funding that was restored after a systems improvement agreement was made with the Federal Centers for Medicare and Medicaid Services. The agreement made this week brings on consultants to assess needs for improvements, establishes accountability, and monitors levels of staff training, restraint use, and safety.
Our patients are not getting the right care at the right time in the right settings.
The care is lacking across the state.
The panel argued for more trained staffing to allow mental and behavioral health patients to be cared for properly.
It's time we quit treating mental health like a second-class disease.
It is a disease to be treated no different than other disease.
We can't afford to wait any longer to mend these holes in our safety net.
The legislative session ends in less than 4 weeks. The systems improvement agreement, which prevented a loss of millions of dollars in funding, extends through May of 2018. Stephen Karen?
All right, we should know more in the next couple of weeks then.
All right.
Thanks, Joe.